On the computer desktop, double-click the simpleABI icon. When the program opens, select File, New ABI-Q report. The report will open, and you can enter patient information, risk factors, symptoms, and ICD codes. Note, approximately 30% of patients with PAD symptoms, but a normal resting ABI diagnosis will have an abnormal diagnosis after exercise. Your practice will improve the clinical diagnosis of patients with PAD by implementing a short exercise program in your vascular diagnostic testing. With the patient in the supine position, wrap 10 cm cuffs at each ankle site, 1 inch above the ankle bone. Attach the bladder portion first. Place the cuff under the ankle and around the ankle, holding it in place with one hand while wrapping it with the other. Be sure to follow the Velcro strip and wrap the cuff straight. When wrapping the cuffs, the patient may try to hold up their leg to help, but ask them not to, because when they relax their leg the cuff may loosen. Attach the hose to the cuff as shown. Have the patient exercise to increase blood flow to the extremities in one of the following ways. 1. Preferred, have the patient perform 50 dorsiflexions, raising the toes towards the shin while in the supine position. 2. Standing on the floor, while stabilizing on the back of a chair or the bed, have the patient perform 50 heel raises or until exhaustion. 3. Hall walking for up to 5 minutes or until exhaustion. After exercise, to obtain a PVR waveform, click on the right PVR button in the middle of the screen. If there is a symptomatic leg, perform the test on that leg first. Pump the aneroid to roughly 80 mm of pressure and then slowly deflate using the gray button to roughly 65 mm and stop. The center section of the target pressure gauge will turn green, if red, too low or too high. When a constant green, click on the Get Waveform button. Note, PVRs require patient cooperation, limb motion affects the waveform. Patients should be instructed not to move or talk during this test. The waveform will start to appear after approximately 10 seconds. If you are not satisfied with the waveform, leave the cuff inflated, in the green, and click on the Get Waveform button again to overwrite the previous waveform. Release the air in the cuff by completely depressing the gray button on the aneroid and move the hose to the left leg cuff and repeat the above steps. On your computer keyboard, press the Tab key to highlight the left leg PVR section or simply click on the left leg PVR button. Repeat the waveform sequence for the other leg. Under each waveform will be the calculated ABI-Q. ABI-Q guidelines. ABI-Q greater than 1.00 indicates normal. ABI-Q between 0.90 and 0.99 indicates borderline risk of PAD. ABI-Q less than 0.9 indicates increased risk of PAD. When finished, save the report if desired as described in your user manual.